Anglia. Let's speak to the broadcaster and journalist Sonia Poulton. Afternoon to you, Sonia. I know you've been quite vocal about what you see as the restrictions on our lives going forward. It looks as if there's another load coming our way.
Yes, indeed. I'm actually furious. That briefing this morning left me so angry, Ian. It's like we're back in March and we've not learned anything at all about COVID. And back there, we were driven into panic buying and lockdown by media repeating government line without question. And COVID-19 has been a failure of both government and media. And for example, just after what was said in the meeting today, so now media are now trotting out that we are going to be getting 50k cases a day by mid-October. Where is the basis for this information? I know the gentleman you were just speaking to said a lot of this information is already in the public domain, but the reality is those are our two most senior scientists and medical officer, and actually they are part of the problem.
So you don't believe the 50,000 figure?
Well, what's the basis of it, Ian? The problem is we've never. They just haven't been straight with us from the get-go. Let me go back a little bit to give you some context to what I'm saying. In March, I became very ill myself, and it's very likely that I was experiencing COVID. I had 2 tests. Both of them were negative over a period of like 3 months. I was really quite sick. But I also started to make a lockdown documentary because I wanted to separate the fact from fiction of what we were being told. And it became evident to me very early on when I was being contacted by funeral directors, doctors, nurses, some of them now suspended by the BMA for speaking out. And it became evident to me that we were not operating from correct statistics, be that testing, be that death certificate, and the rise and fall of lockdown is dependent on figures that are unreliable. And the truth is, the lockdown cure has been deeply damaging, and we have yet to see the full top.
But just help me out here. When they say that yesterday the figures were I think it was 3,009, just shy of 4,000 people yesterday were confirmed as daily cases. Are you saying that you disbelieve that figure? Because that's obviously that's the figure that Whitty and Vallance base it on, and if you follow the pattern, that would double up, and then you get your 50,000 cases.
Well, let me give you one example of why their figures are problematic, because the number of cases in London fell from 2,335 for the period September the 4th to the 10th to 1,699 for the following period, the 11th to the 17th. And yet Sadiq Khan wants to lock us down in London when the cases are falling. So it depends who you're listening to. I know what the government scientists say, but even they know that their data is shaky at best.
But if there's 50,000, if the 50,000 translates, as they said today, to 200 deaths a day, what do you make of that? Do you dispute that?
Yes, absolutely, I dispute it, because didn't you notice how they didn't use Sweden as an example? We're busy looking at other countries that will support their idea of a second lockdown. But what about Sweden? They didn't use that as an example.
So what's in it for them? Why would they lie, Sonia? What's the reason for not being truthful? Should put it that way.
There's a number of things, I think. I don't always think that it's just outright blatant lies. I think that sometimes they've been caught short and they don't know what to do. This is a failure of leadership. Where's Boris Johnson? Where's Matt Hancock? Why were Whitty and Vallance wheeled out to do this? Why wasn't it a proper press conference where we could ask questions? I've witnessed this chaos firsthand, Ian, as I say, in their figures. When I went for testing, for example, they even told me at the testing, the laboratories were in chaos. I submitted FOIs to government. They wouldn't respond. We know that COVID is not a high infectious disease. In fact, it was downgraded 2 days before we went into lockdown. We cannot enter into a second lockdown without a full evaluation of the first lockdown. And it is really troubling how easily we all run along with it. And when you say what's in it for them, right, there will be a number of things that will be in it for them, not least because they've started, so they must finish. But did you notice there were a couple of sort of slip-ups that Vallance made? And at the core of all of this is definitely a drive for a COVID vaccination, of which the government is heavily financially invested. And in fact, 3 days ago, a vaccine consultation ended with the government in which they want to put out unlicensed vaccinations and have anybody be able to administer them. That's the sort of madness that's going on right at this moment in time. And furthermore, what else is in it for them is that we are covering the government's tracks.
When you say anyone to administer them, I mean, what, like me?
Yes. Well, who knows? That they didn't say. They're talking
I'm
about.
pretty sure I wouldn't be able to give a vaccine, would I, for coronavirus?
Well, sincerely hope not. But what about people in the army, for example? You know, we're not talking just medical staff who may be able to do it. It could well be untrained medical staff.
Is this not a bit conspiratorial, Sonia?
No, and that's where the problem is, Ian, is that it sounds conspiratorial, doesn't it? But go online, look at the government consultation. It talks about expanding who can give those vaccinations. It talks about
putting. But that might be a pragmatic thing, to get as many people with the vaccine as you possibly can.
You want to be vaccinated by an unlicensed vaccine by somebody who isn't actually licensed to give it, because I certainly don't. I mean, these are very serious questions that we as journalists must be asking, certainly. You know, and I did find it interesting that Vallance made that interesting slip up. We will be living with this virus for some time, okay? Because that is central to all of this. As I say, the government is heavily financed. We've got to get away from the idea of conspiracy theory when we're actually dealing with conspiracy facts.
If these figures are true and we got to mid-October and 200 people a day were dying, 1,400 people a week, conservative estimate, would that not be enough for you to think we need to take some action? Or would you disbelieve those numbers?
Well, but we're looking into the future here. I'm looking at where we've come from, and what I'm saying is that nothing that they said to us previously has come to pass. Remember Ferguson's insane modelling that sent us into lockdown in the first place, and that's what I say. We're starting it all again. This is what I'd like to say, Ian, is that I talk to lots of people, scientists and doctors. There's not only one science on this, there's many science on this. And this Friday, for example, I'm launching a live stream on brand YouTube where I have 4 doctors who will come in and answer questions from the public, people who are highly trained and experienced to answer these questions, not Whitty and Vallance, whose salary depends on saying exactly the right thing, but people who don't have a dog in the race.
All right, we will listen, Sonia. We will definitely speak again. It'd be interesting to follow up how that Q&A goes as well. I'm sure Mr. Whitty and Mr. Vallance would say, you know, I'm not doing this because of my pay packet. I'm sure there's greater dosh to be made elsewhere around the world in their environments. But thank you. That was Sonia Poulton, the journalist who's been investigating this from day one. Not happy with what she sees.